Now, the national capital here in Accra and Ghana's biggest city, Kumasi, have bounced back to life today following government's decision to lift the 3-week partial lockdown. As you know, the lockdown was necessitated by the increase in cases of COVID-19 being recorded here in Ghana. Currently, the country's case, like I told you, is standing at 1,042. But addressing the nation yesterday, President Akufo-Addo outlined his reasons for arriving at that decision to ease the restrictions on movement.
The decision to impose restrictions on movement was backed by the data at hand. And our next course of action, again, is backed by data and by science. In view of our ability to undertake aggressive contact tracing of infected persons, the enhancement of our capacity to test, the expansion in the numbers of our treatment and isolation centers, our better understanding of the dynamism of the virus, the ramping up of our domestic capacity to produce our own personal protective equipment, sanitizers and medicine. The modest successes chalked in containing the spread of the virus in Accra and Kumasi, and the severe impact on the poor and vulnerable. I've taken the decision to lift the 3-week-old restriction on movements in the Greater Accra metropolitan area and Kaswa, and the Greater Kumasi metropolitan area and its contiguous districts. With effect from 1 a.m. on Monday, 20th April, I must make it clear at the outset that lifting these restrictions does not mean we're letting our guard down. All other measures are still firmly in place. For the avoidance of doubt, the earlier measures announced on Wednesday, 15th March, which have been extended, are still very much in force and have not been relaxed. I'm demanding even greater adherence to these measures. In here, I'm referring to the suspension of all public gatherings, including conferences, workshops, funerals, parties, nightclubs, drinking spots, beaches, festivals, political rallies, religious activities, and sporting events. All educational facilities, private and public, are to remain closed. Businesses and other workplaces can continue to operate, observing staff management and workplace protocols with a view to achieving social distancing and hygiene protocols.
So that decision has been met with mixed reactions. Some have been jubilating over the opportunity to finally get to move around unhindered. Others are also questioning the rationale. Some of you have also been reacting to this on our social media handles, and you can still send in your message to our WhatsApp line 0540-109-009. I'll read it out to the rest of the world very shortly. But yesterday on the lockdown show with Emefa Apau, Information Minister Kojo Opon-Nkrumah gave us further details on government's decision to lift this ban.
At the time, the restrictions or the second level of restrictions in Accra, Greater Kumasi and contiguous districts were being introduced. We said they were being introduced because we had recorded cases.
Okay.
That was never the justification.
Yeah.
I recall the president said it, to explain it over and over again, that a restriction or a set of restrictions on their own without more achieves almost nothing. It's only a delay, because once you lift, you won't achieve much.
Okay.
And that the set of restrictions, or what you call the lockdown, were necessary to afford the government and the health authorities an opportunity to do something. What is that something? To do an enhanced tracing and testing program of at-risk populations so that we could get ahead of the virus. Tonight, if you listen to the president, he explains exactly what we needed to do, about 4 things. We needed to have clarity on what our infection rate or what our positivity rate is. And you notice that in many jurisdictions where they were not able to set themselves up early or catch it early, by the time they start examining what is going on, the positivity rate or the infection rate is pretty high. A lot of people who will be getting it or who will now be accounting for that have high viral loads showing up in the hospitals. The hospitals are not able to contain all of it. So what we sought to do was to impose these restrictions and get ahead of it. So try and determine what is the positivity or the infection rate, try and understand the dynamism of the virus, try and understand the geographic footprint and establish current and potential hotspots of the virus as well. And these were the elements that go into trying to get ahead of it. Now clearly we know, and if you look at the data, at least as at the 8:34 data, if you look at the data, our infection rate was about 1.37. The president updates us with the latest numbers, and I'm sure you heard me speaking to the health service team that says that they are quickly updating the platforms as well. But as at that time, you notice that our infection rate, while the composite was 1.37 as at that time, if you disaggregate it, routine surveillance, that's those who were prior to lockdown falling sick and coming to hospital, was about 2.25%. Okay. Out of the 15,000 people who said we have symptoms, check us, 2.25. Then those that we quarantined was about almost 6%. But those that we went out into the at-risk populations, we set a target of about 10,000. We've done about 60,000 now, and there's still backlog that they are trying to process. It's 0.86%, at least as at these numbers. We have clarity of what our positivity or our infection rate is. On top of that, what is good is that the majority, and the president explains, the majority, the overwhelming majority of people that we are finding are people who are not sick. They have been exposed, but they are not sick. Why is that important? If you don't have a robust system for early testing to find people, go aggressively and get ahead of the virus, you will wait. And people will fall sick and come to the hospital. That's when your health structure gets overwhelmed. And that's what I was explaining, the data from New York, the whole of America, about 1 million beds. And they were projecting that the way it was going, they were going to get about 2 million people in the hospitals because they had waited. The good thing about what we've done is that because we are finding asymptomatic people, and that's what the president talks about, they are not sick, many of them don't even require hospital care. If you continue with this, you would then be able to find people who are asymptomatic and therefore give them the treatment, and they don't have to get into that category of critically ill. At the same time, a third thing you need to do is to introduce measures that will slow down your rate of spread. So if your rate of spread is at about 0.86, at least using the 834 set that we had, what are the measures that you think can sustainably, what are the sustainable measures that you think can slow down the rate of spread? Mm-hmm. Different options. There's total lockdown of the entire country. There's partial lockdown of some parts of the country where you think the at-risk populations are to go after them. Then there are restrictions. Beneath the restrictions, then you have public compliance with the preventive etiquette, so social distancing, wash your hands, etc. That is being maintained. The restrictions are also being maintained. Borders are remaining closed
for another 2 weeks.
Public gatherings, social gatherings, conferences, all of those ones are all being...
So no church?
Still. No church, no mosque, no big conferences, all of that kind. Even for businesses, and if you listen to the text, because you see you have a list of options, right? Yep. As I said, the basic one is public compliance with the preventive etiquette. In fact, today if you are following what's happening on the global platforms, in America, they are saying that if public compliance had started earlier than it did, they could have even cut their rate by about 50%. Okay. So public compliance alone, as from about you take from the 6th of March when we were celebrating independence and the president kept saying, don't do this, from that time alone, cuts into our potential 0.86 by a lot. I'm not using the American standard of 50%, but I'm just saying it cuts it by a lot. Then you come to the next level, restrictions. Borders are remaining closed, schools are remaining closed, public gatherings are remaining, all of those restrictions still exist. In the markets, we're going to have better policing in the markets to ensure social distancing. In public transport, better policing to ensure social distancing. In corporate organizations or in businesses, you heard the president talk about the fact that they need to rationalize numbers, because you are still saying that people, as many people as possible should stay at home. Okay. So you have to rationalize all of it. That again cuts the 0.86 into, severe. Then you add to it the next layer of an even enhanced testing program. And you heard the president talk about 100 different points, different layers that we're adding to our testing capability to ensure that we're able to trace more, test more, and ensure that while you are cutting into the potential infection rate, you are also finding a lot more people, or the majority of your people, in the early asymptomatic bracket so that you can assist them. And then you don't need to have people, getting ill and in hospital. So this is what the science leads us to come to, and that's why we're here tonight.
So there's a directive that we're all supposed to wear masks once we are going out there. Very good, but you know that there were some social distancing protocols that we're supposed to adhere to. Clearly, most people did not adhere to it. How are we going to ensure that we all wear masks starting tomorrow? So,
first of all, if you say most people, I may have a challenge with you. You know, I don't like this overgeneralizations. But a good number of people were not observing the social distancing. But listen, take Accra. If you had 6 million people all over Accra not observing social distancing at all, mingling, the moment you impose some of these restrictions, you would observe that a good cut into that is happening. And if you had, is it 500,000 people or 200,000 people? Yes, it's a significant number, but compare that to 6 million. Now, your question really is about how do we police it and ensure that it's going to happen. The role of the police and the military is now going to change. They are not now going to be enforcing a lockdown, but they are going to be assisting us ensure that some of these other restrictions are adhered to.
I'll tell you what the Director General of the Ghana Health Service is saying, but right now some of you have been sending your comments on the lockdown. I'll take quick ones on that and then we'll go to the Ghana Health Service. It says, if you're president and you follow Ghanaians, you can't do anything better. The problem is Ghana journalists. Some are not asking the right question. Okay, well, you have some strong words. We'll skip that one because we don't accept insults on the show. But you say what the president has done is the best. It's from Christopher Konto. Christopher, thanks for sending your message. Next time, please do not add insults. This one says, hello, Gifty. I still don't understand why those of us that came into Ghana from other African countries on the 20th of March were not contacted to be tested, because they said those who came in within that period are supposed to be tested. Report yourself to any Ghana Immigration Service. They are asking that landlords, anybody who traveled within 3rd and the 20th, I think 22nd or 20th of March, should make it themselves available. If you haven't had any call from the Immigration Service, do make yourself available. Let's go through this so we don't infect other people, and those who are infected are also treated. This one says from Nyonja Bright in Sunyai, says the government can propound theories and ascribe to any scientific reasons for lifting this lockdown. In fact, it failed to plan for the vulnerable, and having realized the difficulty feeding them, had no choice than to lift the ban. Otherwise, how can governments that cannot provide simple masks for its health workers not be interested in preventive measures? Well, Bright, thanks for sending in that message. What is in the lifting of the ban when cases continue increasing? I beg the president to re-examine the issue carefully. You don't add your name, but thank you for sending the messages as well. Let's see quick two last one, and then we go to the Director General of the Ghana Health Service. This one says, it's from Zabzugu, from Obed, Nwesan Obed in Zabzugu Tamale, Zabzugu in the northern region. He says, I think the president may be right or wrong for lifting the restrictions of movement in Accra and Kumasi. However, if you think it's dangerous to go out, stay at home, whilst those who think they can't take the risk to go out do so. Let's not give too much pressure to the president, because our feedback always serves as the basis for his next address. Leadership is difficult, you know. Thank you for sending in, Obed, your message. Very touching message you are bringing in as well. He said, this one says, please, unemployed graduate teachers are suffering from the lockdown. Please, any assurance? Well, the lockdown has been lifted, so there are no excuses there, I should say. All right.